MyBreast today has grown steadily and very nicely. We now work all over the country, and we recently at our London headquarters have opened a non-surgical clinic where we have experts who are able to give non-surgical treatments and skincare, and it very much complements the whole MyBreast environment and philosophy.
I'm Sarah Prescott. I'm one of the nurses here at the non-surgical clinic. We offer the latest non-surgical facial rejuvenation treatments here, including dermal fillers, wrinkle relaxing injections, chemical peels and the dermal roller for scarring.
Facial aging is driven by two processes. One is inside the face, which is related to your genes. It's called intrinsic aging. The second part is called extrinsic aging, and that's related to the environment that you live in. And the two biggest extrinsic aging processes that occur are related to sunlight and smoking. And these accelerate the aging process of any face, and so that this is the reason that some people seek treatment to try and reverse those aging processes.
Dermal fillers are made up of hyaluronic acid, which is a substance that we have in the skin naturally. As we get older, the cells deplete, so during a treatment we would just be treating static lines on the face. Typical lines would maybe the nose to mouth lines, lines around the mouth. We can also use the dermal fillers to plump up the lips and give them some definition.
Fillers used to fill areas which you've got fixed wrinkling, which are not necessarily always related to muscle action, but they're related to a laxity of skin and loss of elasticity. And the filler refills that volume or lifts that wrinkle so it actually looks more youthful. During a dermal filler treatment, this is either done without or with a local anaesthetic. Either that's done as a little injection into an area to produce numbness, or EMLA, which is a form of local anaesthetic cream. And then the needle is inserted below the wrinkle you're trying to fill, and the material is injected below the wrinkle to lift it out.
A dermal filler isn't a painful treatment. It normally takes between 30 minutes and an hour. After the treatment, the area may be slightly swollen, maybe slightly red, but that normally goes down within 48 hours. So you can expect the results to last between 4 to 9 months, and then you just come back for a top-up treatment within that time frame. Dermal fillers can be used in conjunction with other non-surgical treatments. Most commonly, people will have a dermal filler treatment in conjunction with a wrinkle relaxing injection. Wrinkle relaxing injections prevent the muscles from contracting, which form fine lines and wrinkles. This involves a series of injections which prevent old wrinkles from appearing and new wrinkles from forming.
What you have is you've got facial muscles around the eye, up in the forehead and actually all over the face, and these produce a motion of the tissue and skin, and they produce what is called dynamic wrinkling. So this treatment actually stops the action of these muscles, and that's how it works on dynamic wrinkling. During a treatment we use a very dilute solution of the botulinum toxin, which is diluted in saline and then injected into areas where there is muscle action in the face.
A wrinkle relaxing injection treatment would normally take about 30 minutes. After treatment, you can expect slight redness to the area injected. You can return to work almost immediately. Occasionally, you can have some very mild bruising to the area.
Usually, you'll see an effect within about 10 days following the treatment. You can expect a very flat and wrinkle-free forehead, a wrinkle-free crow's feet, which are the two very common areas of treatment, as well as the glabellar area, which is between the brows. It does, however, wear off. So this treatment needs to be repeated anything from 3 to 9 months following treatment.
Chemical peeling is a topical solution that we use to rejuvenate the skin, therefore reducing fine lines, blemishes on the skin and some types of pigmentation.
During a skin peel treatment, depending on the depth of peel and the peeling agent you're going to use, you apply the peel with either a cotton bud or some applicator onto the area you want to treat. And then you will see sometimes in some cases a frosting, which then disappears, a little bit of redness following it, which again disappears.
During a chemical peel, you can just feel some tingling on the skin and maybe a little bit of warmth. After the treatment, you can expect to be slightly red for an hour or so afterwards. You can go back to work. You can expect to see some peeling between 3 to 5 days after the treatment. We do recommend a course of 4 treatments and they will be 1 week apart.